Hi, I'm Caitlin White. This is the 360 of the room that we're going to be using. Let's set back up. Okay, hi, I'm Caitlin White, and I'm going to be performing your cardiac exam today as well as your peripheral vascular system exam. Do you have any questions before we start? No? Okay. So first I'm going to just inspect your neck. We're going to, where'd your phone go? Look at your jugular venous pressure. So, and I'm going to look at your carotid. So I'm just going to have you turn and look to the side. Okay, and turn it to the other side. Okay. I note a pulsation of the internal veins bilaterally, and I also see some visible carotid pulsations as well. Next, I'm just going to kind of pull your gown up just a little bit here and just look for the point of maximal impulse. This is on the fifth intercostal space down the right or down the left sternal border, right at the midclavicular level. I do not see any heaves or lifts at the PMI. Now I'm going to palpate your carotid arteries. I'm going to do one at a time. Your left carotid artery is +2. And your right carotid artery is +2. No thrills bilaterally. Now I'm going to palpate the angle of Lewis. This helps us kind of see where the second intercostal space is. I'm just going to kind of lift the gown up so I can feel what I need to feel. So I'm going to go to the second intercostal, and I'm going to palpate each area, the aortic, pulmonic, tricuspid, and mitral areas. I'm looking for any pulsations or impulses that may be irregular. So I'm going to first check at the right sternal border, the second intercostal space. This is the aortic area, and I feel no pulsations or impulses. And then I'm going to walk my fingers over to the left sternal border at the second intercostal space. This is the pulmonic area, and I feel no impulses or pulsations. And then I'm going to walk down to the tricuspid area, which is just at the fourth intercostal space at that left sternal border, and I feel no pulsations or impulses. And then again, we're going to go to the mitral area, which is at the apex, the fifth intercostal space, midclavicular on that left sternal border. And I can feel a small, gentle tap, so the amplitude is normal, and this is a normal finding here. Now I'm going to use my diaphragm and my bell to auscultate the carotid arteries for any bruits. I'm going to have you taking a deep breath when I listen. Go ahead and take a deep breath. Next, deep breath. Okay, I'm going to do the bell now. Deep breath. Deep breath. Perfect. There, I heard no bruits bilaterally with the bell or the diaphragm. Next, I'm going to listen to each of those four areas that I palpated again, the aortic, pulmonic, tricuspid, and mitral. I'm going to listen with the bell and the diaphragm. Just going to lift this up. right, I'm going to listen with the bell this time. I'm going to start with the aortic area. And then move on to the pulmonic. The tricuspid area. And the mitral. All right, her heart rate was 84 beats per minute in regular. I hear an S1 and S2. I hear no murmurs, no gallops, no rubs, clicks, in all four of those areas. Now I'm going to have you lay on your left side. This way? Yes, left side. So with you on your left side, I'm going to listen to that mitral area, the apex again with the bell, and I'm just going to be listening for any murmurs or any S2, S3 heart sounds that might be more. With the patient in the left lateral decubitus position, I'm listening to the apex with the bell. I hear no S3, no S4 murmurs or mitral stenosis. All right, I'm gonna have you sit up and lean that way off the side of the bed. And I'm gonna listen to this area again with the diaphragm. Can you lean forward a little bit? All right. With the patient sitting up and leaning forward and holding their breath, I am listening along the left sternal border and I hear no aortic murmur. All right, I'm going to have you lay back down for me. So now I'm going to move along to the peripheral vascular systems, and I'm just going to start with the arms. Just by looking at them right now and feeling them, they're both warm to the touch. I'm just going to look at the fingers, and I see no cyanosis. The color's good. Both arms are symmetric. I see no swelling, and the capillary refill is less than 2 seconds in both fingers. Now I'm going to check the radial and the brachial pulses on each arm here. All right, the brachial pulses are +2 bilaterally, and the radial pulses are +2 bilaterally. Now I'm going to have you flex your arm at the elbow about a 90 degree. And I'm just going to be pushing between the bicep and the tricep here. Okay, I'm going to do the other one. I'm palpating for the epitrochlear node, and I do not feel them, so they are not palpable. Now we're going to do the Allen's test. So for the Allen's test, I want you to open and close your hands a few times and then make a tight fist. All right, go ahead and make a tight fist. And then I'm going to close off the ulnar and the radial. And then I would like you to open your hand. And the palm is pale. I'm going to release the radial. All right, and then I want you to do that again, and I'm going to release the other side. All right, close your hand. All right, open. We're going to release the ulnar side. All right, on this left side, after releasing the ulnar and radial artery, the blood returns back to within 5 seconds, indicating no arterial insufficiency on this side. I'm going to do the same thing on this right side. Open and close your hands for me. All right. I'm going to release the radial. Great. Do it again. Release the ulnar. Perfect. This hand too on the right side, the color came back in her palm in less than 5 seconds, indicating no arterial insufficiency on that right side with the Allen's test as well. Now I'm just going to go inspect your legs. They are symmetrical. I see no discoloration. I see no swelling, no pitting edema. They're warm to the touch down to the toes. The skin and the nail beds are pink. Cap refill in the toes are +2. Just gonna move this down a little bit so you can see the legs. So +2. I'm gonna go ahead and start feeling pulses. I'm gonna go ahead and start with the femoral pulse. The femoral pulses are +2, and I'm also palpating in the inguinal nodes to see if there's anything, and I do not feel any palpable nodes. And then I'm going to move along to the popliteal pulses, which are just right behind the kneecaps. Popliteal pulses are +2 bilaterally, and now to the posterior tibialis. And those are +2 bilaterally. And now to the dorsal pedius. And those pulses in the dorsal pedius are +2 bilaterally as well. Again, I note no pitting edema, and cap refill is less than 2 seconds. I'll put your socks back on, and then I'm gonna have you stand up, and I'm just checking for any varicose veins or anything like that. I'll do that last. I'll do this first, sorry. Put your socks. I'm going to first just check your arterial insufficiency. I'm gonna hold both of your legs up until your feet are pale, and then I'm gonna have you dangle them over the side of the bed. So, just gonna lift these up here, and you're a little tan, so I won't really know. It says about a minute, so keep them up for about a minute, and then I'll have you dangle them over and then stand up. All right, I'm gonna have you dangle them over the side of the bed here for me. All right, so foot parlor developed, holding the legs up for about 60 seconds. The feet returned color within 10 seconds, and the whole leg returned with color within 15 seconds. I'm going to have you stand up for me real quick. I'm just looking for any varicose veins, anything like that. And I see no varicose veins or any signs of arterial insufficiency. And that is the end of the assessment. Do you have any questions?
I do not. Thank
you.